Hi there, I'm Jerrica Dodd, your pharmacist and your advocate, and today I'm going to talk to you about how to prepare to get your blood pressure checked in the doctor's office, or how to prepare to check your blood pressure if you happen to be checking it at home. You see, as a pharmacist, I get asked often, how can I get off my blood pressure medication? Can you help me cut down on the number of blood pressure medications I'm taking? And my answer is yes, I can help you with that. I can work with your healthcare practitioner and you to develop a plan so that you can either reduce the number of medications you're taking for high blood pressure, or maybe you can discontinue them altogether. However, not so fast. There's some things that we have to do first before we can even start talking about the medications. So, we won't discuss medications in this video. Take note of these tips. In order to develop a plan so that you can reduce or discontinue your blood pressure medicines, we need to have an accurate baseline of where you're starting. We need to know what your blood pressure is now, and it needs to be as accurate as possible. So these are some of the things that you can do to make sure that the number you get in the doctor's office or the number that you're getting at home are accurate. You want to make sure that you do not consume any caffeine within 1 hour of getting your blood pressure checked. So don't drink a caffeinated beverage on the way to the doctor's office, because they're going to check your blood pressure and caffeine can increase your blood pressure. So no caffeine within an hour before your appointment or of getting your blood pressure checked. And if you're at home, make sure that you don't consume any caffeine within 1 hour of checking your blood pressure at home, because again, caffeine can elevate your blood pressure. You also want to make sure that you don't smoke within 30 minutes before getting your blood pressure checked, because just like caffeine, nicotine can increase your blood pressure. And we want to make sure that we have an accurate as possible reading so that we know where you're starting, remember? I also want to encourage you that when you're taking your blood pressure at home, or if you're in the doctor's office, make sure that you're sitting in the chair with your feet planted on the floor. Don't cross your ankles or cross your legs. And make sure that you're sitting with your back to the back of the chair and that your arm is elevated to the level of your heart. So this means maybe you rest your arm on the exam table, or if you're at home, maybe you do a blood pressure check in the dining room or the kitchen at the table, and you can rest your arm on the kitchen table. However, you want to make sure that that arm is elevated till about the height of your heart or the level of your heart so that you can get a more accurate reading. The other thing to consider is before you check your blood pressure, make sure that you sit still for 5 minutes. I know that seems like a long time, but 5 minutes. Make sure you sit still for 5 minutes. Think about when you're at the doctor's office. You come in, pay your copay, sit down, you're filling out paperwork, they call you back, you get up, you walk to the back, get on the scale, and then once they finish with you on the scale, they take you to an exam room and a medical assistant or nurse comes in to check your blood pressure. Well, I encourage you to ask them, can I have about 5 minutes just to settle and get ready for you to take my blood pressure? Because I want to make sure we get an accurate reading. And I don't think they will have a problem with that. Same goes at home. If you're about to take your blood pressure, sit quietly in a chair, just calmly, 5 minutes, and make sure that you're ready to take your blood pressure so that you get a more accurate reading. If you're running around the house and then you plop down in a chair and take your blood pressure, it's likely that you're not going to get an accurate reading. The other thing that I want to suggest is that for your home check of your blood pressure, make sure that you're using a blood pressure monitor or meter, if you will, that has a cuff that goes around your upper arm. There are different types of blood pressure monitors, and you want to make sure that you have this type so that you can get a more accurate reading. There are some that will measure your blood pressure at your wrist. It looks like a bit of a cuff that goes around your wrist, and those are not going to give you an accurate of a reading as this type of blood pressure monitor will. So make sure that this is the type that you purchase. You can buy it at a local drugstore, you can buy it online, but this would be more accurate in checking your blood pressure. It's important that you remember these things so that you can have that accurate baseline. So as you're working with your pharmacist to work with your healthcare team in developing a plan for reducing or discontinuing your blood pressure readings, you know exactly where you're starting. So Keep these things in mind and you can get an accurate blood pressure reading every time. If you know someone who can use this information, I invite you to go to the Facebook page of Your Pharmacy Advocate and share this video with them. Invite them to like the page. You can also invite them to be a part of our Facebook community group. It's called Empowered Health CEOs, where we talk about all things health and we become the CEOs of our health as we continue to share information and learn more and more about how to take charge of our health and be an active part of our own healthcare team. If you would like a complimentary consultation with a pharmacist, look below this video in the comments for a link to my schedule, and I'd be happy to spend 15 minutes with you to talk about how a pharmacist can help you take charge of your health. Thank you.